Hello whizzes. Welcome to my channel. Today's topic is Introduction to Anemia. Anemia is a common medical condition that affects millions of people worldwide. At its core, anemia is a disorder of the blood. To understand it better, we need to explore the fundamental components of blood and how they work together to keep our bodies functioning optimally. Blood and its components. Blood is a remarkable and complex bodily fluid that plays a vital role in maintaining life. It circulates throughout our bodies, supplying oxygen and nutrients to cells while removing waste products. Blood consists of several key components, each with a specific function. Red blood cells, RBCs. These are the most abundant cells in our blood and are responsible for carrying oxygen from the lungs to every tissue and organ in the body. The unique shape of RBCs, like tiny donuts without the hole, allows them to carry oxygen efficiently. Hemoglobin. Inside each RBC is a molecule called hemoglobin, which binds to oxygen in the lungs and releases it where it's needed. Hemoglobin is crucial for oxygen transport, and its levels are closely linked to the ability of blood to carry oxygen. White blood cells, WBCs. WBCs are essential components of the immune system. They help the body fight off infections and illnesses by detecting and destroying harmful pathogens like bacteria and viruses. Platelets. Platelets are tiny cell fragments that play a critical role in blood clotting. When there's a cut or injury, platelets quickly gather at the site to form a clot, preventing excessive bleeding. Plasma. Plasma is the liquid portion of blood, making up about 55% of its volume. It carries nutrients, hormones, waste products, and cells throughout the body. Plasma is mainly composed of water, electrolytes, and proteins. Role of red blood cells, RBC, in anemia. In anemia, there is typically a deficiency in the number of RBCs or a decrease in their quality. This results in reduced oxygen carrying capacity in the blood, leading to symptoms like fatigue, weakness, and shortness of breath. Anemia can be categorized by specific RBC-related issues, such as reduced production or increased destruction. Role of hemoglobin in anemia. Hemoglobin levels are closely associated with anemia. In most cases, anemia is characterized by a decrease in hemoglobin concentration in the blood. Hemoglobin's role in binding and carrying oxygen is compromised, further contributing to the reduced oxygen supply to tissues and organs. Role of white blood cells, WBC, in anemia. White blood cells primarily function in the immune system to defend against infections. While WBCs themselves are not directly related to anemia, certain types of anemia, such as those caused by chronic diseases or autoimmune disorders, may involve underlying immune system dysregulation. Role of platelets in anemia. Platelets are primarily responsible for blood clotting. In some types of anemia, especially those related to bleeding disorders or bone marrow disorders, platelet function may be affected. This can lead to an increased risk of bleeding or difficulty in forming clots. Role of plasma in anemia. Plasma, as the liquid component of blood, doesn't change significantly in anemia. However, it carries nutrients and waste products as usual. In cases of anemia resulting from nutritional deficiencies, plasma may reflect decreased levels of specific nutrients, example iron or vitamin B12, related to RBC production. The consequences of anemia. Anemia leads to reduced oxygen delivery to tissues, which can result in various health problems. Since oxygen is vital for energy production and overall cellular function, anemia can manifest in a range of symptoms, including fatigue, weakness, paleness, and shortness of breath. In severe cases, it can affect the function of vital organs like the heart and brain. In conclusion, anemia is a condition that revolves around the fundamental elements of blood, particularly red blood cells and hemoglobin. These elements are crucial for oxygen transport, and any disruption in their quantity or quality can lead to anemia's characteristic symptoms. Understanding the role of blood components is essential for grasping the intricacies of anemia and how it impacts the body. In the subsequent sections, we will explore the various types of anemia, their causes, symptoms, diagnosis, and treatment options in greater detail to provide you with a comprehensive guide to this condition.